Healthcare staff faced intense pressure in the past year on the front lines of this global pandemic.
And amid the stress, some are finding silver linings, rolling out new technology and developing breakthrough therapies.
As Denver 7's Russell Haythorne reports tonight, these innovations can help us rebound now and be better prepared for the next pandemic.
How's the staffing?
In a normal era, healthcare innovation is costly and takes years to advance.
They come in through the front doors here.
Enter the silver lining of the COVID-19 pandemic.
They get tested for a temperature check.
Just like warp speed advances in vaccine development and distribution.
They sit in this chair here.
At Swedish Medical Center in Inglewood, healthcare innovation is also on the fast track.
On this iPad here is a provider.
For example, the ER check-in process now features an iPad where a nurse practitioner or a doctor like Nick Sippis
We're not in the waiting room yet.
is in the back listening as soon as the patient walks through the door, cutting out multiple steps, touch points, and layovers, so to speak.
To keep folks safe and to expedite their time in the emergency department, we can learn about you in real time while also simultaneously looking up your past records.
Up at Colorado State University,
try to collaborate with others. Vaccines against what we call pan-coronaviruses.
A state-of-the-art type scenario. Scientists and researchers like Dr. Marcela Henao Tamayo are already developing a vaccine for the next pandemic.
Not just the ones that we know about, but the ones that we know might be infecting humans in the future are currently probably in some animal species, like they could be in bats and probably some others.
And Dr. Greg Dean and his team are even developing an oral vaccine.
Lactobacillus acidophilus, a probiotic bacterium that's in a lot of different foods, including yogurt, an orally delivered vaccine strategy. It's a complicated process, but we have reduced it to a manageable procedure.
Those advances would have the potential to reach people in third world countries and virtually every corner of the world.
It doesn't require refrigeration. That is not so easy everywhere in the world. Now you don't necessarily need trained medical personnel to deliver it.
COVID-19 may have been a gut punch, but it also motivated the best among us to find solutions so that we're never caught off guard like this again.
When we're able to do something to put our skill sets to use, to solve problems that people have in our community, we're paying back and we're paying forward that investment that they make in us.
It's the first time that we saw that there was some interest in trying to be prepared for the next pandemic.
Russell Haythorne.
And that is a wonderful thing.
Denver 7.